Hi and welcome to this video about post-hysterectomy soft tissue therapy. There are about 55,000 hysterectomies that are carried out every year here in the UK, so it's by no means uncommon. It's the second most common procedure carried out on the abdominal wall for women, the first being C-section. So in terms of the type of different procedures for a hysterectomy, you may have a different scar set. So first of all, you may have a scar that looks similar to a C-section where they cut just above the pubic bone to remove the uterus. Or it could have been removed laparoscopically, in which case you will have like a triangle of insertion points around the stomach where they've gone in to remove the uterus, then down through the vagina. So there are lots of different scars that can present on the abdominal wall post-hysterectomy. So bearing that in mind, I'm going to show you this model here of what I'm going to say this is our abdominal cavity. Okay, so there's movement in it, it's elastic, exactly the same as our abdominal cavity, but as soon as we compromise that by snipping into it, then the pressure of this is going to change and the structure of this model will change, particularly if you have a scar that looks like a C-section where we slice all the way along the top of the pubic bone, would be a bit like snipping one of these pieces of elastic. So it's going to change the structure of everything. When everything's put back together again, it's never going to be exactly the same as it was at the beginning. But soft tissue therapy can be really, really helpful for that. So around scar area itself, you could experience some bumpiness or some numbness or a little bit of localized pain. So a bit of massage therapy over the area can start to re-stimulate the nervous system and also bring fresh oxygenated blood to the area and just start to break down any lumps or bumps in scar tissue there. Okay, so it can really improve the improve what the scar itself actually looks like, the appearance of the scar. Secondly, when the uterus is extracted, there is a complete change of pressure inside the abdominal cavity. And that change of pressure can be a bit problematic for things like bowel function. So a nice bit of colonic massage can really try to stimulate the gut and get bowel function sort of a little bit better, bringing bowel function back again, and hopefully that will improve bowel movement. Also, with removal of the uterus and that change of pressure, unfortunately, the risk of prolapse does actually slightly increase by about a third. Okay, so that soft tissue therapy keeps that tissue moving. It keeps it soft and it keeps it supple, and that's really important. My background in personal training, specifically for women, I do a lot of pelvic floor work as well, so I can help you with not only the soft tissue therapy, but also how to fire up your pelvic floor, how to move using your pelvic floor, and thus continuing to reduce the risk of pelvic organ prolapse as well. Soft tissue therapy around the area can also help with things like back pain, which is really common post-hysterectomy, again, as that pressure has changed in the abdominal cavity. The way that you hold your pelvis may have changed, so back pain, shoulder pain, neck pain, chest pain around here in the pectoral area, and obviously abdominal pain as well. Soft tissue therapy can really help just ironing those kind of things out and softening the area too. If your hysterectomy is old, you can still work with that. You can still move that scar tissue and soften everything up, as well as if it's quite recent as well. You just need to be signed off by your doctor. Now, obviously, a hysterectomy is going to be unique to every individual as to why a woman has decided or been advised to have that procedure. So just working with it and talking about it can really help in terms of just moving on from it and learning how to manage yourself and how to live going forwards as well. So if there's anything there that you wish to send me an email, give me a ring, then please feel free to do so. Last thing about that soft tissue therapy is just stimulating the rest and digest part of your nervous system, which is really, really important, especially just literally in modern day life when we're, being pulled in so many different directions and there's so much going on. So that can really, really help with relaxation, with sleep patterns, and yeah, just getting a little bit of downtime in during a session. So if you have any other questions, please feel free to get in touch. Otherwise, take care, and I hope to see you very soon.